So Alexandra, kind of after you worked through the chief complaint and the history of present illness, what are some other really important things to learn about in the patient's history?
So of course, if there was any past history of cancer or injury, of past surgeries, infections, any vascular deficiencies that could have happened somewhere else, and I don't know. I'm thinking like any type of tumor.
Mm-hmm.
Yeah.
Yeah, very good. So, the components of the history and physical are, chief complaint, history of present illness. As you've touched upon, you really want to know about the past medical history, the past surgical history. Oftentimes patients may not remember to tell you everything there, so then you want to look at their medicines and, for example, ask them, why are you taking aspirin, or, why are you on Coumadin? Things that are important, especially as you get closer to, surgical decision making. Allergies, of course, then family history and social history. And I think for a spine surgeon specifically, the social history is particularly important. Specifically, whether patients smoke, because that can really impact their healing after surgery. And, I would encourage, as you get into your own practices down the road, just really to learn a little bit about patients, what they do for a living, what their hobbies are. In this day and age, patient ratings and whatnot are very highly publicized. And I think if you take a couple of minutes to really learn about patients and their hobbies, shows them that you are interested in more than just their problem, and also may help your relationships with them. Let's say you both happen to like baking, like this patient did. Okay, so her past medical history was, I would say, by and large, not pertinent. Certainly for diabetes, you want to know how well that's controlled and what their hemoglobin A1C is. Generally, anything above 7.5 or 8 can portend a worse prognosis if they do need surgery. So you'd want them to get that under control prior to any intervention. She did not really have any pertinent past surgical history. Medicines were appropriate to her past medical history. And then for her social history, she worked as a medical transcriptionist, loved to bake, and was not a smoker.
Hey everyone, Ryan Rad here from Neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.